Did you know that the classroom is the most challenging area to engage students with active learning? To transform nursing education and better prepare students for practice and licensure, transforming how nursing education is taught in the classroom by moving away from content-heavy infobesity lectures is priority one. Today in this video, we'll discuss practical strategies to innovate your classroom to get students active participants and engaged in the learning process. Nursing education remains in need of radical transformation. This was the findings of Dr. Patricia Benner and the Carnegie Foundation back in 2010. The problems that nursing education faces haven't changed. And in order to bring about the needed transformation in our programs, we need to do three essential paradigm shifts. Contextualize content to the bedside of patient care. Integrate class and clinical learning, and emphasize the clinical reasoning as that thinking in action skill that develops the outcome of a clinical judgment. But what strategy accomplishes and integrates each of these essential paradigm shifts? An unfolding case study. Prepare the way for active learning in your classroom by making time for active learning. Limit lecture to no more than 15 to 20 minutes and emphasize need to know practice-based realities, not textbook content that's just simply regurgitated from the publisher. Emphasize need to know content for first-year generalist nurses. And I've developed a suggested guide to simply develop a practice-based lecture that begins with these essential components. Number one, pathophysiology. Then go into diagnostic and test and lab results. Then clinical manifestations of the problem, the priority nursing assessment and plan of care. Then go into medical management, pharmacology, nursing process, and care plan that includes holistic and psychosocial care priorities. And then problem recognition. What could go wrong with this most current problem? And then patient education. But there's one simple strategy that we can use in nursing education to transform your classroom, and that's getting your students to come to class prepared and then use active learning to transform and innovate your classroom. And I've developed a skinny reasoning framework that's an unfolding KeithRN case study that has two parts. Part one could be done as a preparation for class activity. It's only 2 pages, and it has aspects that are related to interpreting and noticing relevant clinical data of the vital signs, assessment, diagnostic results. And then part two goes, then what's the meaning of all of this as you put it all together and think like a nurse? What is then the primary medical problem, the nursing priority, the plan of care? What will the medical management be, as well as holistic care priorities and patient education? You can have your students break out in small groups and work on these class questions together, and then come together, and then no longer do away with the sage on the stage and be that guide on the side. And if to be empowered to confidently develop clinical judgment with your students, I've just published a helpful resource using what I've learned from my dissertation on unfolding case studies, as well as my own observations in practice, and developed an educator's faculty guide to develop clinical judgment. Check out the link in the video to obtain your copy that includes faculty implementation guide in the classroom and the clinical to easily implement active learning. I also have a free skinny reasoning case study on COVID-19 and other resources on my website, KeithRN. If you found this content helpful, be sure to subscribe to my YouTube channel, Think Like a Nurse, and don't miss the next video in this series on transforming and strengthening clinical reasoning in the clinical. Thanks for watching.